Recall the face of the poorest and the weakest man you have seen, and ask yourself if the step you contemplate is going to be of any use to him. These are the noble words spoken by the visionary leader, nationalist, and the man of the masses, Mahatma Gandhi. He believed that the heart of India lies in its villages and will only thrive on quality healthcare and sanitation. His vision and practice, almost half a century earlier, laid the foundations of healthcare in India. Since then, community health centers, district health hospitals, and medical colleges have formed a network of primary healthcare in our country. Coming back to the recent times, there's no doubt that Indians have successfully battled polio, a long-standing threat, infant mortality, and have boosted rates of life expectancy up to 65 years for male and females combined. But the Gandhian dream to the future of India is far from these facts. Welcome to the diabetic capital of the world and the country with the maximum number of undernourished people globally. Some places even worse than the poorest parts of sub-Saharan Africa. In this light, Padam Foundation explores if India's healthcare is here to serve or to suffer. A rather worrisome report of the State Health Index was generated by the Niti Aayog in 2019. The report ranked Indian states according to their health status based on 23 indicators broadly divided into 3 categories: health outcomes, governance and information, key inputs and processes. To be specific, under 5 mortality rate, tuberculosis prevalence, the sex ratio at birth, and quality accreditation of public facilities, to name a few. And the outcome? A stark north-south divide with health deficit scores clustered primarily in the 50 districts belonging to the states of northern India. And Uttar Pradesh ranked number 1 with an index score of 28.61 with the poorest health outcome. It seems like Uttar Pradesh, the state which is home to a fifth of the country's population, has kept healthcare in its lowest priorities. The people of the state are always running short of affordable, accessible and quality healthcare, faring a large share in spreading communicable and non-communicable disease deaths. Maternal deaths, neonatal mortality, cancer, tuberculosis, typhoid have also skyrocketed in the state, with no expansion of public healthcare institutions for the past couple of years. It's no surprise that the neighboring states of Bihar, Orissa, Uttarakhand and Madhya Pradesh are right behind in their index score, underserved by health services. Amidst these alarming statistics, there were room for some good news from other states like Rajasthan and Haryana, which showed some improvement, and some even more happy news from the southern states of Kerala, Andhra Pradesh and Maharashtra. However, this left us with an important question. Why is there an imbalance of healthcare services from state to state? And we found answers that were all interconnected. Number 1. Scarcity of healthcare expenditure. In the broader sense, India's economy needs a huge dose of health spending because as per the latest update, the country only uses 3.6% of the GDP on healthcare, which is way lower than many of the other countries in the world. Number 2. Shortage of medical workforce. Since the health sector creates much of the high-skill and low-skill jobs, a shrinking of health infrastructure means a lack of health workforce in the country. Number 3. Neglected rural India. Vacancies for doctors in rural centers remain unfilled because they refuse to serve in these parts of the country with poor water, electricity and sanitation facilities. In fact, only 31.5% of hospitals are situated in rural areas where 75% of the country's population resides. So there's no wonder that states like UP, Bihar, Odisha, and Madhya Pradesh, with wide spans of rural areas, fall short in timely health services. Did you know that on an average, a government doctor attends to 11,082 people, which is more than 10 times than what the WHO recommends? The fight isn't over yet. In the coming years, India is yet to brace up and eradicate HIV/AIDS, tuberculosis, leprosy, cancer, diabetes, hepatitis, mental health issues, and the newfound COVID-19 pandemic to achieve health goals. But all of this with these frightening statistics? Absolutely no. Presenting to you our remedy to ensure health for all. As an NGO, Padam Foundation understands the pressing needs and health challenges that our country needs to overcome. We make sure that no underprivileged population of India lose their lives due to negligence and poor health facilities. And we strongly live by the belief that healthcare resources can be distributed to those in need if for once technology and healthcare talk to each other seamlessly. We do this not only through channelizing your time and donations to the needy, but also sharing the wealth of knowledge to them so that they adopt better family planning strategies, sanitation practices, early vaccination, and improved lifestyle to prevent common diseases. Come, let's blur the line between health and wealth for a healthy population of tomorrow.